All right, just because people want to know, plastic surgery has really evolved over the years, and there's some new stuff that I can't believe is going on.
I love
Great
this
stuff.
topic, so we asked Dr. Amir Tahernia to give us all the insight on what's new.
So I'm lucky enough that I see the whole spectrum of aesthetic patients, but I think the biggest thing now is less work, more non-invasive, more non-surgical types of treatments.
So you're talking like fillers,
Exactly.
things like that.
Fillers, Botox, fat transfers.
Ooh.
Which is, I mean, a little more invasive, obviously.
Yeah, but it's not like full surgery like it used to be. Like I feel like, you know, 10, 15 years ago, it was like, let me get a full facelift.
Right.
But like people aren't doing that anymore.
Well, they're still doing it, but they're not doing it at a younger age. Right now they're waiting until they're, you know, in their late 60s or mid 60s to do major operations. But the younger patients, whereas before they may want to do things to prevent, you know, the long-term aging issues, now they're doing these less invasive things. In particular, fat transfer has become a major thing. Okay,
and explain to me, first of all, what that is. And second of all, explain to me where is the most popular place to put, like, where do you put it?
Great question. So, as we age, just a little background, as we age, we lose fat in our face. Yeah. So if you look at a youthful face, it has more fat.
Volume, right?
Volume.
Like their cheeks are plumped and like everything's all plumpy and...
Exactly. So that's actually a better way of saying it. There's more volume. And so if you look at that same person as they age over the 5, 10-year, 20-year period, besides the skin getting a little bit loose, they also lose that volume, which comes from fat. And so...
Where do they lose it?
They lose it in the cheeks, and they also lose it in this area here, and some over the...
in like right here, right?
Supraorbital area above the eyebrows as well. But it's mostly in this area.
Right.
And so, whereas before they used to put implants, cheek implants.
That could go awry so quickly because we've seen some celebrities that went awry with the cheek implants.
Right, and you know, it's a foreign material that can get infected. Now what they're doing is they're restoring volume by taking patients' own fat. And so you know what liposuction is. So liposuction is essentially how we do it. So if someone has a stubborn area of fat in the flank or abdominal area, which is very common, a procedure is done when the patient's awake, where we harvest the fat through liposuction, and then we actually prepare that fat in small vials or small syringes, which we then inject into pre-marked areas in the face, usually in what we call the mid-face, and then a little bit up top as well.
Dr. Amir, is that a twofer? That's a tummy tuck and a facelift, all in one.
It actually is. It actually, I mean, depending on what the patient's situation is down below. I mean, if they have a lot, then no. But if they have like a little bit of a stubborn area, it can actually take care of two problems.
Interesting. Okay, so that's what's happening now, and you've been in this business. You've been in the game a while. So what do you see on the horizon for plastic surgery? What is next? What's the new cool thing that everybody's going to be talking about?
I think what I was saying earlier. You want to basically do less and get more natural results. A lot of the older techniques in plastic surgery were pretty radical, and it's never good when someone can tell you had something done.
Right.
I mean, people know you may look more refreshed, but I think having a natural result is what's important. So I think less invasive techniques, along with a combination of what we talked about, these non-invasive fillers and fat transfers, that I think is what we're heading to. Correct. But also, just on the topic of fat transfer, I just wanted to speak about safety is very important.
Well, I mean, look, the thing is that if you go to some esthetician down the street, or not to say that estheticians don't know what they're doing, they do, but there's some that are completely unlicensed, and you hear these horror stories of people because it's cheaper.
Absolutely.
Don't mess with your face or your body or your health, right?
Absolutely. So I'm a board certified plastic surgeon, and there's about 9,000 of us in the whole country. That doesn't mean that other people can't be doing cosmetic procedures, but their understanding of complications are not as good. Some patients that I've seen in my practice, and you may have heard of, I'm sure the public has as well, is silicone injections into the buttock that's gone wrong. And they come to me, and it's a big problem. And so we have people that are non-qualified doing these things. And when it comes to your face, they have to have a good understanding of the anatomy. So if they inject something and in the wrong area, it could be a problem. So you got to check your doctor's qualifications to make sure that they know what they're doing. And When things are going well, it's fine, but when things go wrong, it's when
Well, that's what you need to know.
Exactly.
So obviously, look for somebody that's board certified.
Correct.
And it might not be the most inexpensive route, but it's the safest, and that's probably better when it comes to any kind of surgery.
Absolutely. When it comes to your body, you're not looking for deals. You're looking for someone that gives you the best and safest result.
Right. All right. So your practice is in Beverly Hills.
Correct.
And you've been doing this a long time, right?
Well, I've been doing this for 10 years. The training is 10 years long.
Of course.
I mean, but in all, I mean, I've been in plastic surgery for about 20 years, but in my own practice, private practice, in about 10 years in Beverly Hills. And it's great because I get to see the whole spectrum of not just cosmetic surgery, but also reconstructive surgery.
All right.
Which is important.
It certainly is. Thank you so much for coming in.
My pleasure. Thank you for having me.
Nice to see you.
Nice to see you.